And I'm going to share my screen. There we go. So welcome to the February 2023 Lunch and Learn. We're going to be talking about new health laws passed in recent years that affect minors and children. To begin with, you may be wondering, what is the Office of the Healthcare Advocate? We are a Connecticut state agency that was created in 1999 as the Office of the Managed Care Ombudsman. That name was changed in 2005 to the Office of the Healthcare Advocate. And we consist of a staff of nurse consultants, attorneys, paralegals, and other professionals who assist Connecticut consumers with healthcare and health insurance issues. So this can be something as simple as, your insurance, they're sending your statements to the wrong address and you, for whatever reason, haven't been able to get that straightened out. We can work with them to straighten that out for you, all the way up to something more serious, like your doctor says you need a procedure, your insurance says, well, we're not going to pay for it. And we can step in and assist you to make an appeal. We can take it all the way up to the external appeal level, and really, work with all the parties to help get this resolved in a way that works for you, the consumer. These services are free of charge to the consumer. We are funded through through an assessment that is that insurance companies pay into the insurance fund. So that's who we are. And today, I'm going to talk about new health laws about minors and children, changes that may affect you this year, or in a couple of cases in upcoming years. So just as a little bit of background, every year, both Congress and the Connecticut General Assembly and the various regulatory agencies make changes to the law that may impact your rights. It's worth mentioning that some healthcare benefits are only subject to federal law, meaning that if the Connecticut General Assembly passes a law that says insulin is free to people who are insured in Connecticut, and you say, great, I'm in Connecticut and I have health coverage through my employer, that law may not apply to you if your employer has created something called an ERISA plan, which is a self-funded plan that can only be regulated by Congress, or if you're enrolled in Medicaid or Medicare. Medicaid has a state component, and Medicare is the one that's exclusively federal. Or veterans benefits, for instance, are only subject to federal law. So we'll start with federal law, and then we'll get on to state law. I want to talk about two relatively large. First of all, the big one is the Consolidated Appropriations Act, which was signed into law last year by President Biden. It includes a couple of things that folks ought to know, mostly having to do with Medicaid and CHIP. So first of all, since the start of the pandemic, there has been continuous enrollment and eligibility for Medicaid, meaning that if you lost your job and you lost your health coverage and you went on to Access Health Connecticut and you put in your income information, it might be the case that at some point during the pandemic you were eligible for Medicaid, for Husky. And if at any point in the pandemic you enrolled in Medicaid, you have not had to recertify since the start of the public health emergency. And that is coming to an end in April of this year. I was working on these slides last night. The slide doesn't say April. Beginning in April of this year. This is coming to an end, meaning that now folks are going to start to be asked, basically a 1/12 of the folks. They've divided up everybody who's in Medicare. I think it's based on the date that you came in, and so they're going to reach out to a 12th of the total Husky population and say, we are going to start needing your paperwork again. You're going to have to recertify. That's going to be a big process. That's going to take a while to roll over, and a lot of folks are, I hope, going to come off of Medicaid, and because their incomes have improved. And so if you're no longer qualified for Medicaid, you will be qualified for Access Health. And I'll tell you that the options right now, the subsidies for Access Health are pretty good, better than they have been before. We have, first of all, the enhanced advanced premium tax credits, which limit the amount that you'll have to pay. The subsidies are generous, and there's no what had been called a benefits cliff for the next couple of years. It doesn't matter how high your income is, you'll only have to pay a maximum of 8.5% of your income in premiums for a silver plan, the benchmark plan. In addition, if you are low income, there's a program in Connecticut which is called Covered Connecticut, which provides additional money. It provides money for you to cover some of the other costs than the premiums, such as your copays and other out-of-pocket costs. So you should be aware of those things. You should feel free to contact our office when you get that notification about recertification, or if you hear anybody who does, contact our office. You can also contact the Department of Social Services, which is handling the whole process, because they are the Medicaid agency in Connecticut. So that's the first bullet point. The next four I will go through more quickly. The Consolidated Appropriations Act has made permanent what had used to be an option of what's called continuous 12-month eligibility for Medicaid and CHIP. Connecticut has not taken up this option, but now that it's a permanent and mandatory feature of Medicaid and CHIP, all the states will have to do it. And what this means is that if you enroll in Medicaid or CHIP because you qualify for it based on your income and your other qualifications, that enrollment is essentially good for 12 months. So if this is gonna give people whose work is seasonal, for instance, some stability in their coverage. Let's see. Yeah, that's as much as I have to say about that. It gives people stability, and it also, honestly, it saves the state a little bit of paperwork and processing of enrollments. There are, give me a moment. Someone's trying to get into this room. Thank you. The third thing is that the Consolidated Appropriations Act creates permanent 12-month postpartum coverage. This had been another option, but for folks who have just delivered a baby, postpartum coverage is an important piece of public health. It's an important piece of the recovery process from delivering a baby. There are some improvements to Medicaid funding for Puerto Rico and the other U.S. territories. The territories are not funded in the same way with Medicaid. And so though these improvements, there's more generous federal participation than had been in the past. And that doesn't necessarily affect people in Connecticut, but I know that Connecticut has, there are a lot of people from Puerto Rico here, people with family in Puerto Rico, and I thought I would mention that. And there are some additional Medicaid and CHIP mental health requirements for youth involved with the justice system, including requirements to establish a plan of care for mental health within a period of time after youth exit the justice system, which I think is very good. My next slide, the other federal law that I want to talk about is the Bipartisan Safer Communities Act. This expands some behavioral health services. For instance, there's a demonstration called the Medicaid Certified Community Behavioral Health Clinic. It expands it to all the states. It calls for additional CMS guidance on accessing behavioral health services through telehealth in Medicaid and CHIP. I don't believe that guidance has come out yet, but look for that this year. It includes some funding for pediatric primary care to access mental health specialists. And this is going to help pediatricians and other pediatric folks to, to check in with mental health specialists. Is there a mental health intervention that's necessary? Should we be catching something earlier? It includes as well some grants to support mental health awareness in school-aged youth to connect youth to needed behavioral health services. Turning over to Connecticut, we're talking a lot about children's mental health in the last year. A lot of these laws will only affect the fully insured plans, which are the ones that can be regulated by the state of Connecticut. So Public Act 22-47, an act concerning children's mental health. The thing that our office is most involved in, I think, is the one that I've put in bold here, the enhanced notification of OHA services in adverse determinations and denials. So up until January 1st of this year, the carriers were required to put a notice that OHA is available to you for, if you want help appealing these denials, but it didn't say where they had to put it. It didn't say anything about the language they had to use. So they put us, down around page 7 with the alternate languages and some of the other sort of boilerplate language. But as of 1/1, all the fully insured plans are required to put a notice in a call out box on the first page that says that help is available to you from the state of Connecticut through OHA. And we have been seeing an uptick of cases in this calendar quarter relative to prior years. I don't know if correlation is not necessarily causation, but it seems to me that it's likely that the enhanced notification has had something to do with that. Other things that this bill has done that affect children, it establishes the DCF Mental and Behavioral Health Treatment Fund, which provides assistance to families for the cost of drugs and interventions. And that's something that goes through DCF, I believe. It requires fully insured plans to cover 2 mental health wellness examinations without cost sharing, in the same way that you get your annual physical without cost sharing, or you get some of your other preventative checkups without cost sharing. It mandates coverage of evidence-based services for children and adolescents, and it revises, and we talked about this a little bit last month. It revises surprise billing, provider collection, and mental health coverage statutes to afford out-of-network urgent crisis center services the same protections as out-of-network emergency services. So, if you're in a physical emergency, you go to the emergency room, and there are certain protections there in the law, in your insurance law. If you're having a mental health crisis, and you go to an out-of-network or urgent crisis center, those same protections are available to you. And similarly, it revises the network adequacy standards to require equivalent access to urgent crisis centers, as well as it amends plans are not allowed to require prior auth for urgent crisis center or acute inpatient psych services after an emergency department admission or a referral from a treating clinician. So that's going to help folks not have to deal with some red tape before getting into some of those clinics and inpatient services. The next one is Public Act 2281, an act expanding preschool and mental health and behavioral services for children. This establishes a social determinants of mental health fund at DCF for assisting families with the cost of mental health services for children. So that's again, that's going to help folks who are needing those resources. And it also clarifies, and I thought this was interesting, that the prohibition against telehealth facility fees applies to hospitals whether the services are provided on or off campus. So hospitals cannot charge a facility fee for a telehealth visit. And I believe this is my last one, Public Act 22-118. And this is big. This extends through age 12 Husky eligibility for undocumented immigrant children, and it allows undocumented immigrant children ages 13 to 19 to remain on Husky if they are income eligible and they're not eligible for other coverage. So this is going to, a lot of immigrant children don't have healthcare options, and they can age out. Right, a couple of years ago, they provided state-funded Husky through, I believe it was age 8, but then those kids could age out. So this year it's up to age 12, and they don't age out until they turn 20. So that's going to help a lot of people. Oh, that wasn't my last slide. I did this late last night, so I apologize to you for this. Public Act 21-22, this is from 2 years ago. It requires that insurers issue explanations of benefits in accordance with the instructions of the insured. Now, why does this affect children? Is that, you may have, teenagers or even, young adults who are still on the plan of one of their parents, but they may have, health information in their explanation of benefits that in their view, it's not safe for a parent to see. This can be, access to reproductive health services. This could be access to, gender nonconforming services, or even just, seeing a therapist. So insurance companies now have to issue an EOB only how the insured wants, which is to say they don't have to send an EOB to the subscriber of the plan, which would be, the dad or mom who works for a company. They can issue it just to the insured individual themselves. They cannot issue an EOB except on request, things like that. And finally, Public Act 21-149, there was mostly a technical change to align Connecticut law with the federal requirements to cover dependent children through the end of the policy year in which the child turned 26. Previously, it had been through the end of the month in which the child turned 26. And I believe this is at variance with the federal requirements. The Connecticut law includes coverage of dental and vision through the end of the policy year when they turn 26. All right, I think I have a little bit of time to answer questions if there are any questions. But what I most want you to take away from this is that the Office of the Healthcare Advocate is here for you. Please feel free to send us your questions. You can see the numbers on the screen, 866-466-4446. Healthcare.advocate@ct.gov is a good way to email us. And we're here for you. There are no, these are complicated topics. There are no dumb questions, and we want to hear from you and we want to help you. At this point, I'll stop recording and I'm happy to take some questions. I have to figure out how to stop recording first.